Hi everybody, it's Katie. I wanted to talk to you today about overactive letdown, which I have. I noticed that I had it with my first daughter and it's back again. And for those of you who have this issue, you'll know that it kind of can cause some problems with feeding your newborn. They're not ready to take on the fire hose and they usually get pretty mad, like really mad, and it can cause issues, air bubbles, gas, all kinds of stuff. So what I did this time, which I wish I would have done last time, I did get a little bit of help last time, but I wish that I would have gotten more help last time. I went to someone who is an IBCLC, which is an International Board Certified Lactation Consultant, someone who does this for a living, who's been doing this. So I met with a wonderful woman. Her name is Joyce, and she's been doing this for about 16 years. And she gave me some really good tips, and it's actually changed the nursing relationship that I have with my daughter. It's been great. The first thing that she suggested is when you nurse, you get the pillows all set up, prep yourself, get your elbows so you're not hurting your neck. She said always keep the bottom a little bit lower than the head. That's just kind of, I mean, that's, you'd think, duh, you know, gravity. But anyway, make sure the bottom's a little bit lower. Make sure there's a good latch. Babies need to have like a fish lip. So it kind of needs to be like that, where the lips are flanged out. This one, when she was born, she liked to tuck her lip like that. And so we worked on that. She and I worked on that. And so fortunately her latch is pretty good now. But make sure there's a good latch, and go ahead and let her start nursing. Once the letdown happens, and for me, I don't know about any of you, but when the letdown happens, I feel there's a sort of a tingling, so I know it's coming. She said when the letdown happens, pull the baby off of your breast and have a burp cloth handy, and just you don't necessarily need to touch the nipple because it actually might slow the flow, and you don't want to do that. You're kind of trying to help ease that. And so you go ahead and you have the burp cloth, and you let the milk spray into the burp cloth for a few minutes. And if it slows down, excuse me, for one moment, she lost it. If the flow slows down, sorry, if the flow slows down, you can hand express a little bit. Until things start to kind of slow down. Excuse me, while I help her find what she's looking for. So once you've kind of slowed the flow down a little bit, you can let the baby reattach. And she said to pay attention to the cues. When the baby she might stop nursing, like this one does. If she stops nursing, that's a good time to stick your finger in, pop the suction, pull the baby off, and burp her. She said that for mamas with overactive letdown, it's important to burp your baby maybe a little more so than normal, just because they are going to get a little bit of extra air. So she said, pull the baby off, make sure you burp, and you can do the burping over the shoulder. You can have the baby sit basically almost like Indian style and have them lean over and pat the back. She said that's another option, but burp often. Then once you've got a burp out of them, or at least have attempted, let them reattach and continue nursing. And I think actually one of the biggest things that helped us is once she's attached, to take baby's bum and scoot it close to your body and tight. And basically what that's going to do is that's going to take the baby's chin and shove it into your breast and pull the nose away. So that's going to help with suction, that's going to help with keep their latch good and strong, because another thing which I didn't mention, another thing that we were dealing with is she was clicking. She was losing suction because my milk was coming out so quickly. She was losing suction, and so she was clicking, and every time she clicked, she gulped in a little bit more air. So those things have actually ultimately completely changed our nursing relationship, and she's quite a bit happier. There's not as many bubbles in her tummy, and so thankful for that. One last thing that the lactation consultant suggested was when you're burping the baby and you have them up on your chest and you're patting them. The other thing you can do is, if you imagine this is their lower back diaper line, if you take and kind of just gently massage in a circular motion, it will help move that air bubble up. So I've done that and have been actually really successful. So those are the things that I learned about dealing with my overactive supply. If you have an overactive supply or you're having a hard time, I would encourage you to find a lactation consultant. Breastfeeding, you would think, okay, I've got a nipple and I have a baby. It's going to be easy, but it's actually not. But I would encourage you to continue. Find a lactation consultant who can help you, because it will get better. It will get to the point where all you have to do is just pop the baby on and you're good to go. But in these early times, it's not always quite so easy. But keep going. It will get easier. And I encourage you to develop a nursing relationship, because it's a really rewarding relationship to have with your baby. Okay, that's it. If you like our videos, please click like and subscribe so you'll get emails when we publish new videos. Thank you for watching, and have a good rest of your day. Goodbye.